Hello, and welcome to today's HealthITSecurity.com webcast, sponsored by Iatrix Systems, what covered entities need to know about OCR HIPAA audits. I am Elizabeth Snell, Senior Editor at Xtelligent Media and moderator of today's presentation. We will begin with a presentation by our feature speaker, followed by a brief word from our sponsor. Time permitting, we will conclude with a question and answer segment. Audience members can submit questions at any time during the webcast using the question tool to the left of their screens. For all technical matters or difficulties, click the Help icon at the top right-hand corner of the screen. Audience members must enable the Flash plugin in their browsers to view the webcast. A copy of the presentation slides is available under Event Resources to the left of your screens. A recording of the webcast will be made available following the presentation. Iliana Peters serves as Senior Advisor for HIPAA Compliance and Enforcement at HHS Office for Civil Rights. She is the National Lead for OCR Enforcement of HIPAA rules and works closely with OCR's 10 regional offices to promote compliance with HIPAA rules. Additionally, she supports many other OCR policy and outreach initiatives, including rulemakings, compliance initiatives with other federal agencies, and training, including of the State Attorneys General. With that, I would like to hand the floor to Iliana to begin today's presentation.
Great, thank you so much. I do just need to let you all know that the opinions that I express today as part of this presentation are my own and don't necessarily reflect those of the Department of Health and Human Services. Standard disclaimer here. I did want to walk you through our enforcement work a little bit more generally to provide some context for you when we talk about the audits that we're doing. So I wanted to provide you with some background on the other parts of the office, the work that we're doing in not only a little bit of policy, but also what we're doing in the enforcement arena as well, so that you can understand the context for our audit program. Hopefully it will all be helpful to you, and hopefully we'll have some time for questions. Some of these slides I will go quickly through because you have access to the slides and certainly can investigate further on our website for additional guidance. There's so much guidance on our website that you can use. And you can also contact me if you have any questions about the slides. Please keep in mind that I cannot provide legal or advisory opinions, but I can certainly talk with you about how the rules work and about how we do our enforcement and our audits. Moving to some background on policy work that we're doing, just a reminder that the 21st Century Cures Act does call for us to produce some additional guidance for the industry, and we're working on that now. So I just wanted to highlight that for you and the areas that we're working on additional guidance with our sister agency, the Office of the National Coordinator, which is referred to as ONC. This additional guidance will really focus on sharing protected health information for research purposes and on any particular barriers to exchange of that protected health information. Our long-term regulatory agenda, which is available through the department's website. So this is information that is updated on a regular basis on the HHS website. The Secretary's regulatory calendar is available to the public. And you'll see here that we are working on two specific items on a long-term basis. The first is our high-tech provision that provides for us to share a percentage of civil money penalties or settlements collected with harmed individuals. And the second piece of that is additional changes to the accounting of disclosure provisions. High-Tech called that we make some changes to our accounting of disclosure provisions. We did a notice of proposed rulemaking that we got a lot of comment on, and so we're going back and taking a look at those comments and figuring out the best way to move forward with those high-tech, the statutory requirements. So more to come on those. I did want to alert you to some recent guidance that we have that's really important and timely. We have ransomware guidance that is available for you. This is really helpful guidance that walks you through not only what ransomware is, what it does, how it may affect not only the confidentiality and availability of your data, but also the integrity of that data, and as such, why OCR considers ransomware attacks to be breaches. So we assume that there has been a breach that requires notification under the HIPAA breach notification rule if there has been a ransomware attack. And of course, the entity would be responsible for doing a risk assessment to show us why breach notification in any particular circumstance is not necessary. So as I said, we walk through this issue in this ransomware guidance, particularly, as I said, what ransomware is, how it works, how it may be deployed in your enterprise, and the risks that it poses for your enterprise, and then why we do in fact consider any particular ransomware attack to be a breach, and how the entity might move forward in the case of a ransomware attack. I note that it also includes a lot of really helpful information about preparing for different types of attacks, including ransomware attacks, and the tools that the HIPAA security rule gives entities to do that. So, certainly if you are doing contingency planning and security incident and response and reporting like the HIPAA security rule requires that you do, you are much better prepared for any particular type of malware attack, including a ransomware attack. So all of those issues are discussed in our ransomware guidance, and the link is here. We also have guidance on cloud computing, and certainly cloud computing is a really powerful tool for entities of all sizes to use. And while we don't endorse any particular cloud vendors, we certainly walk you through the security considerations that you should take a look at when you're looking at different cloud vendors and the different legal issues that might arise under a cloud computing situation with regard to the HIPAA rules. Specifically, we walk through the fact that the majority of cloud vendors are in fact business associates under the HIPAA rules, so they have their own liability with regard to complying with the rules. But also that means that you need to have a business associate agreement in place with those cloud vendors if you're a covered entity using their services, or if you're a business associate using their services for the PHI that you provide services to covered entities for. So again, it's just really good information about not only what cloud computing is, how it works, different cloud solutions that might be helpful in different circumstances, but the different security concerns that we have in any particular cloud computing relationship between covered entities and business associates, or business associates with other cloud business associates, and really what we're looking for in terms of agreements, business associate agreements, and other security concerns that might arise. So that's what that cloud guidance is for, and it's very helpful, as I mentioned. We also have a web page that is dedicated to cybersecurity. So obviously this is an issue that's on all of our minds of late in our industry, and understanding the risks associated with cybersecurity issues and cyber attacks is so important for our industry. Much of this guidance was available already from our website, but we wanted to create a page that was dedicated to it so that entities could find these helpful tools very quickly. So this link here at the top of the page is to the web page itself. And then on our cybersecurity webpage, we have several different resources. Our ransomware guidance is there, as I mentioned previously, but we also have, for example, a checklist and infographic for covered entities or business associates that may at the moment be experiencing a cyber-related security incident. So there's a PDF checklist that walks you through the 4 steps that you should take as a covered entity or a business associate in any particular attack situation, and whether that's a malware attack, a ransomware attack, a denial of service attack, whatever the case may be, there are steps that every entity should take And we provide those steps here in this helpful checklist with references to the provisions of the HIPAA privacy and security and breach notification rules that may apply in any particular circumstance. The infographic is just a handy little infographic of that checklist. So it may be helpful to you when you're trying to operationalize this for your workforce, or you're doing training, or if you're a visually oriented person, it's just helpful to have an infographic to sort of see what we mean when we're talking about the 4 steps that the checklist provides. Very briefly, those 4 steps are, as I like to say, the first step is stop the bleeding, and that's implementing your response and reporting and contingency plans. Figure out what's happening within your enterprise related to any particular attack, and figure out how to stop any attack from continuing to be ongoing, and to prevent additional loss of protected health information. And we walk through if you need to get some business associates to help you do that, make sure you have your business associate agreement in place, but certainly bring in the professionals if you need to figure out what's happening in your enterprise and how to stop it. Obviously, that's the first step in any attack situation. Implement those plans and make sure that you can do the best you can to fix the situation as it's happening. The second thing that we suggest all entities do is immediately report to law enforcement. It's a really good idea to know who your local FBI cyber crimes unit contact is, and that way in any particular cyber attack situation, you have that number ready to go so you can call the FBI and let them know that you're experiencing a cyber attack. They may ask you to delay breach notification because they have an ongoing law enforcement investigation, and it's really important for our industry more generally and for national security that we coordinate with law enforcement to make sure that they can catch the bad guys in these incidents. If you do get a request for a hold on any breach notification from law enforcement, obviously that is a requirement under the breach notification rule that you comply with those law enforcement hold requests. And we talk through that in the checklist as well. And then the third step that you want to take in any particular cyber attack is to coordinate with information sharing and analysis organizations. And that may be with my colleagues in the Department of Health and Human Services that don't have a regulatory function. So all they do, for example, is help our industry share information not only about cyber attacks, but about hurricanes, flu epidemics, other events that may affect the industry, or with the Department of Homeland Security, who has information sharing and analysis functions as well. You can do that through the provisions of the Cyber Information Sharing Act of 2015, or you can do that through information sharing and analysis organizations that you may be a member of, and we walk through those types of issues in the checklist as well. And just a reminder that these are what we call threat indicators and defensive measures. So this information does not include protected health information and is really focused on the nature of the attack that you're experiencing and any defensive measures that may be working to combat that attack. So obviously you want to share that information so that others in the industry that might be experiencing the same attack can protect themselves. So that's the third step in any particular attack situation. And then the fourth step would be to comply with the HIPAA breach notification rule or any other state or federal breach notification requirement. So obviously we do want you to report as required under the breach notification rule, but you have up to 60 days to do that. And there are really more important things that you need to do first. And as I said, that's first you stop the bleeding. Second, you coordinate with law enforcement. And third, you share information that is appropriate with information sharing and analysis organizations so that the whole industry can benefit from your experience and potential defensive measures. And then once you get to a point where you have really determined what's happening in your enterprise and it's appropriate to make your breach notifications, then obviously do that as required by the HIPAA breach notification rule or any other state or federal mandates that you may have to comply with. So again, that's information that's available on our cybersecurity webpage. And we also have our crosswalk there with the NIST cybersecurity crosswalk, which is a really helpful tool to the it's a mapping of the HIPAA security rule to the NIST cybersecurity framework. The other pieces that might be really helpful to you available from that website are our monthly cybersecurity newsletters. Pretty much every month we send to our OCR security listserv. If you're not a member of our listserv, I do suggest you sign up for it. We have two. We have a privacy listserv and a security listserv. Much of what we send out goes to both, but these, for example, only go to our security listserv. So really good to be signed up for that if you're not already signed up for that. And as you can see here, the topics really vary, but they're all pretty timely, and they're written in plain language. So we really are trying to help not only the IT people in your organization understand current risks related to cybersecurity, but also these may be really helpful for your workforce training and distribution to your workforce, because we, again, try and make them conversational. They're very short, very simple, provide some good high-level information about what any particular issue is, and then some tools to implement in your organization to really do the best you can to prepare for any particular type of attack. Our most recent one from August is about the prevalence of scammers after any natural disaster. Obviously the hurricanes are on everyone's minds, and everyone wants to be generous, but obviously we need to protect ourselves and our enterprises from any scams related to charity giving. So again, that's our latest newsletter, because that's obviously something that our industry is dealing with now. But again, previous newsletters have ranged from man-in-the-middle attacks to denial of service attacks and what those are, to audit controls, to ransomware. So these, I think, are really helpful and can be used throughout your enterprise. Okay, so getting into audit a little bit here, our audit program is really, it's about supporting compliance within our industry. So it's not necessarily an enforcement function, as you have previously may have experienced through our office. So our office does a lot of investigations that are focused on, for example, complaints that are filed with us, or breach reports that are filed by covered entities or business associates, and we investigate all of those circumstances. So if an individual files a complaint with us, then obviously we still look at all of the complaints that come into our office. Many of them aren't jurisdictional, and we don't move forward with them, but many of them are. And you can see from the examples of cases that we have on our website, including those that move to settlement, that many of our complaint investigations result in entities taking corrective action to resolve any particular situation that led to a complaint. And of course, we also do investigations on issues that aren't related to complaints, and those include breach reports. All breaches affecting 500 or more individuals are investigated by our office, but also breaches affecting fewer than 500 individuals, news reports, referrals from other agencies, including the OIG, FTC, CMS. All of those agencies refer matters to us that we may investigate, and those may lead to requests that the entities take some corrective action, to come into compliance with the HIPAA rules, whether that's updating risk analyses and policies and procedures, updating their risk management plans, improving their training, sanctioning workforce members. Any and all of those things may be issues that might come up for entities during a complaint investigation or compliance review. our audit program is a little bit different, at least the way we're currently implementing our audit program. The first phase of our audit program after the HITECH Act was really to see whether or not and how we could stand up an audit program, and that's what we called phase one. We used contractors to help us do that, and as I said, really we're looking at different techniques that we could use to stand up the audit program. We did some initial audits through that phase one, and then did an evaluation study afterwards to see how we could make changes. Our second phase of the audit program, which is where we are now, was really something that we took in-house. So we did several audits ourselves with the help of on-staff contractors, auditors that were essentially working for OCR, and really worked to implement this within our own program. That said, the purpose of this phase of the audit program was really to support improved compliance in our industry. And so that means what we were trying to do was really take the temperature of our industry and figure out whether or not there were risks and vulnerabilities that entities hadn't addressed, that we could provide additional guidance on, whether or not there are best practices that we can share with the industry, whether or not we need to do more audits, and how we might implement our next phase of an audit program, and how we might develop additional tools for the industry so that they can ensure their own compliance moving forward. So that was really the purpose of this program. It wasn't for purposes of enforcement necessarily. It was really for purposes of consulting with the industry and trying to figure out where we may need to do better in terms of tools and guidance, how we can move forward with an audit program, and to provide feedback for covered entities and business associates on the compliance work that they're doing now. Now that said, if an entity, of course, was found to be particularly egregious or did not respond to an audit request, for example, we can certainly move to enforcement in any particular case. That's not a preference, and that wasn't the point of this program, but certainly we can't, as the regulator, turn a blind eye to egregious behavior or noncompliance. So, where we are in our audit program, we are underway with our desk audits. We have pretty much completed the 166 covered entity audits that we undertook. And we also undertook 43 business associate audits. Those are still ongoing right now. When we determined which business associates to audit, we drew that pool from the over 20,000 entities that were identified by the covered entities that we audited. So part of our audit request to those 166 covered entities was to provide us with information about the business associates with whom they work. And so we use that to build a pool of business associates from which we selected our business associate auditees. So we do hope to do some on-site audits. Again, we're still trying to determine how we are going to do those and how many to do. As you can imagine, on-site audits are extremely resource intensive. So we're just trying to figure out the best way forward to go with our on-site audits. And just because someone was subject to a desk audit doesn't mean they won't be subject to an on-site audit. But as I said, we're just still trying to figure out how to move forward with those on-site audits. Our desk audits were as they sound. They were a request to the covered entity or a business associate to submit certain types of information for us to determine a level of compliance. So basically it was what the entity had at the moment of the request. And while we appreciate additional efforts from the covered entities and business associates to do work to comply, that really wasn't the purpose of this exercise. It was really to take a snapshot in time of the compliance of the entities that we audited in this round of audits. Our process, as I said, after we reviewed the submitted documentation, we shared the draft findings with the entity, and the entity could respond in writing. And again, many entities let us know of the different steps that they had taken or were going to take to respond to our audit and the additional compliance issues that they might have, which of course we appreciate, and we encourage those entities to take additional compliance steps. But our finding was based on that snapshot in time, what the entity's compliance status was at the time that we made the audit request. Our covered entity desk audit controls are listed here. I'll walk through them, but I also wanted to let you know that our audit protocol is available on our website. So it's everything and all the rules. So it's a lot. And we would never audit, well, in my opinion, we would never audit on all of those controls at one time because it's just so much. But it's a really helpful tool for your organization because it tells you, specific to any particular control, the type of evidence that we would be looking for in an audit. What would we be looking for from you, the entity, to prove to us that you have, for example here, a notice of privacy practices, how you provide your electronic notice. Those were two of the issues that we audited on for covered entities, and we looked specifically at what the notice had in it, the content requirements, and whether or not the entity had everything that was required after the HITECH Act and after the changes to the requirements in notice, and whether or not the electronic notice was being provided as required by the rules as well. Again, and that's all listed on our website and how we would look at that. We also looked at the right to access and how covered entities provide access to their patients and beneficiaries when those individuals request access to their protected health information under the privacy rule. With regard to the breach notification rule, we looked at the timeliness of notification associated with any particular breach and the content of that notification. And then with regard to the security rule, we looked at risk analysis and risk management. Those are the cornerstones of the security rule, and everything in the security rule builds on those two requirements. So it's really important that covered entities and business associates understand how important that is for purposes of compliance, and that we understand what that compliance looks like in the industry. With regard to business associates, obviously business associates' compliance with the privacy rule is a little bit different as required by the HITECH Act and as implemented by our omnibus final rulemaking. So we limited our review of those requirements to the requirements for which business associates are directly liable. And that's specifically here, breach notification and security rule. Business associates are required to notify the covered entity of any particular breach situation. And so we looked at the notification by the business associate to a covered entity. And we also, again, looked at risk analysis and risk management for the reasons that I stated earlier. The last slide doesn't want to load. Can someone confirm that you can see the audit guidance slide? Okay. I'm having trouble seeing it on my screen, but this audit guidance slide includes the website that I mentioned that has the links to the website with the audit protocol on it, and will be updated with additional guidance as we develop it after our audits are finished. We are doing some initial analyzing of those audits now and our reports pursuant to those audits. And as I said, this audit webpage is really your best resource for updates to the audit program, updates to tools and guidance related to audit, updates to the protocol. All of that will be available through this this website. So it sounds like you can all see that, and hopefully you'll be able to visit that website at your leisure as well. So moving on from audit a little bit, I did just want to update you on breaches and our breach highlights here on these pages to give you a flavor of what we're looking at with regard to enforcement related to breach, particularly because this is a really important area for our compliance and enforcement program. And I just wanted to give you some updates on our breach numbers. Unfortunately, I don't yet have updates for August, so these numbers are through the end of July, and hopefully we can see you in another presentation soon, and we'll have updated numbers. But these are pretty timely numbers, and as you'll see here, we received over 2,000 reports involving breaches of protected health information that affect 500 or more individuals. I'll get into the pie graphs here in a minute to talk through these additional bullets. But I did just want to highlight that the number of individuals affected by these breaches is huge, and almost 175 million individuals have been affected by the breaches that have been reported to us. So this is all of the issues here that I wanted to highlight for you that we see in breach reports are issues that you really should be paying attention to in your compliance work with your covered entity or business associate, because they are issues that affect a huge number of patients and beneficiaries in our industry. So we've also received approximately 293,000 reports of breaches of PHI affecting fewer than 500 individuals. And as I said, many of those result in investigations as well. So this first pie chart is a pie chart that explains the types of that we see, again, as of the end of July. And this is based on the number of breach reports that we have received. So as you can see, theft and loss are still a huge issue for us. And I like to highlight that because the most important tool to combat breaches related to theft and loss, obviously something for unauthorized access and disclosure and hacking and IT as well, but really a powerful tool with regard to theft and loss is encryption. If you're not implementing encryption solutions in your enterprise, you really should be. Obviously, it's required by the security rule. It's an addressable specification, which means you have to encrypt or implement reasonable compensating controls. So either you're, doing a reasonable compensating control or you're encrypting anyway. So you really should be encrypting if at all possible, because it does prevent the necessity of reporting in a breach situation. That's the safe harbor. So encryption solutions have dropped dramatically in price and in they're not as complicated as they once were as well in terms of implementation within your enterprise. And, as I said, if and when you had a breach due to a theft or to some kind of loss by a workforce member, OCR is going to ask you whether or not you encrypted, and if you didn't, what the reasonable compensating controls you had in place were. The purple piece of the pie here is related to hacking and IT incidents. Those are the cyber attacks and other related cyber incidents. Just a reminder that while encryption is incredibly important in those situations as well, many of those incidents occur while data is live, quote unquote, so any particular encryption solution may not be implemented when that attack occurs. And that's really an important factor to consider and something we discussed in our ransomware guidance. Unauthorized access and disclosure is that green piece of the pie, and that includes things like insider threat. If you're not monitoring your audit logs, which you're required by the security rule to have, and to monitor, you may not have a good idea of who's accessing your information and why. Certainly, your employees may be accessing that information for nefarious purposes. Are you auditing the accesses to your protected information so that you can catch those nefarious activities if they are occurring? Are you appropriately terminating privileges so that former employees don't continue to have access to your information? That was the subject of a recent settlement that we entered into. So all important issues associated with breach reports that we're getting. The next slide also talks about the location of these breaches, and as you can see, anything that's portable electronic devices, laptops, desktops, again, theft and loss of those devices is a huge issue. And again, encryption is your best defense against having to report those breaches. But network servers, emails, electronic medical records are increasingly becoming the victims of not only insider threat situations, but also cyber attacks and other types of breaches. Just a reminder related to this slide that paper records are still a problem for our industry. If you have vendors that work with your paper records particularly, please work with those vendors to ensure that they have the right safeguards in place pursuant to their business associate agreements, and also ensure that your own workforce understands the risks that are still seen associated with paper records. Obviously not something that the security rule would address because the security rule is particular to electronic protected health information, but paper records are still a really important part of the work that we all do. So, just some additional information on complaints. So as I said, our breach reports give rise to what we call compliance reviews, which is a different type of investigation, very similar to the investigations that we do on complaints. As I said, we still look at every complaint that comes into our office, and we have received over 158,000 complaints over the life of our program. Over 25,000 of those have been resolved through corrective action or technical assistance, and that's in working with entities to resolve those complaints to make sure that the compliance issues don't reoccur in their in their enterprise. I do just want to note that we do a huge amount of investigatory work that involves working with entities to take corrective action. We provide them with technical assistance. We help them walk through the requirements of the rules. We help them implement improved compliance programs in their organizations in a very large number of cases every year. And we update Congress on those types of cases on a biannual basis, and we're working on our most upcoming recent report to Congress now, so look for that soon. But I did just want to mention that our settlement agreements make a lot of splash when they come out in our industry, and that's the purpose. They're meant to highlight ongoing compliance issues that we see so that all entities can benefit from the compliance activities of particular entities that may have had either egregious breaches or ongoing systemic noncompliance in certain areas that we can use as a teaching tool. They do, in fact, only represent about 1% of the cases that we investigate. So we investigate and resolve many, many cases that do not involve settlement agreements or civil money penalties. And we exercise our enforcement discretion in those cases to work with entities to bring them into compliance without any particular settlement agreement or civil money penalty. But in certain cases that provide the opportunity for us to provide teachable moments to the industry, to highlight ongoing compliance concerns, and to provide tools on our website, that is corrective action plans that other entities can use within their enterprises, we will proceed to settlement agreements. And in any case that we are prepared to settle, we are prepared to impose civil money penalties. So, again, This is some additional guidance on how we do that. We've updated this web link here to walk you through how we close our cases and how we make additional referrals. So this is really helpful information about the types of cases that we close and how we do that. And our recent settlement actions that I mentioned are here. And as I said, these are really important tools for the industry to understand how to comply with the rules and to understand recent issues that we've been seeing in our industry. So I just wanted to very briefly walk through these final slides on continuing issues that we're seeing in enforcement. These are related to cases that we've been working that you might see on this previous slide, but also other cases that we're seeing in our investigatory work. And then we'll move on to the next presenter. Just here, I wanted to mention very briefly that, there are entities that don't quite understand the situations in which they can affirmatively disclose information. And under the HIPAA privacy rule, that basically is only if there is a specific permission under the privacy rule to disclose that information, or if you get an authorization from the individual who is the subject of the information. So, for example, permitting news media to film individuals in a facility without obtaining their authorization is not permitted by the rules. Publishing protected health information to a website or on social media without an authorization, whether it's Yelp, Facebook, Twitter, any of those platforms, it's not permitted unless you have an authorization from the individual. And so we've been seeing these types of disclosures, faxes to an individual's employer without authorization. Again, not permitted under the rules. So it might be a good idea to review your policies and procedures with your workforce so your workforce can really have a good understanding and a reminder of the fact that they have to find the permission under the rules or they have to have an authorization from the patient. Business associates continue to be an issue that we see. It's really important to have good business associate agreements in place with your vendors so you can make sure that they're safeguarding that information that you hand over to them when they provide services to you. We have additional guidance on our website about that. Incomplete and inaccurate risk analysis, again, a very important issue, as I mentioned before, and an ongoing issue that we see in the work that we do. Particularly because entities aren't looking at all of the protected health information in their enterprise. So this slide walks you through all of the different systems that you really need to look at. Any system, you need to look at any system, any place that protected health information may be maintained, any place that it comes into your organization or goes out of your organization. All of those are areas that you need to assess the risk on that data, and that's what we're looking for as part of our risk analysis requirement. There's guidance on our website available as well. We have a small provider tool that we developed with the Office of the National Coordinator, really appropriate more for small providers. And then there's a NIST tool that you can download. We do not track downloads. Download that NIST tool and use it if it's helpful to you. Once you've done your risk analysis, then again, implementing safeguards that thoroughly manage that risk is also a really important process. Mobile device security is one of those issues that you need to address as part of your safeguards, and there's some information there. Transmission security continually comes up for us, so we've included some issues here that come up quite often. File transfer protocols, email, texting, application sessions, web portals, all of those may have transmission security issues. Auditing, I mentioned previously. Are you looking at your audit logs? Do you understand who's accessing the records and when and why? Is that pursuant to appropriate privileges? Patching of software, so important given all of the cyber threats that we're seeing and how many of those threats take advantage of unpatched applications. Insider threat we talked about a little bit, and again, we would be looking for workplace screening, termination procedures. Disposal, consistently an issue not only with electronic information, but also with paper information. So please review our disposal guidance that is on our website as well, and really try and understand with any particular type of media what may be required. The NIST special publication 888 is really helpful for that purpose. Insufficient backup and contingency planning, obviously an issue that is on everyone's mind, not only due to cyber attacks, but also due to the hurricanes that we've been, as an industry, encountering recently. It's so important to have backup and contingency planning in place so that if you have either a cyber incident or a natural disaster, you can continue with your operations at remote locations. You can continue to help patients and beneficiaries try and get medical care in other locations so that we can continue to move forward to provide the best care and reimbursement for that care in our industry. So our website is here, and we have a Twitter account. Obviously, you can get in touch with me. Also, if you have additional questions, my email address is my first name period, my last name at hhs.gov, all pretty easy to find in the department. So that's iliana.peters@hhs.gov. You can connect with me if you have questions. Again, I can't provide legal or advisory opinions, but happy to try and help you find any particular guidance that may be applicable to your question. And with that, I'm going to hand it over. Thank you.
Thank you so much, Iliana.
I would like to go ahead and introduce Tim Burris, Product Manager for Patient Privacy Solutions at IATRIC Systems.
Thank you very much. A lot of the things that Iliana had just discussed make the scope of patient privacy and the scope of compliance with those OCR regulations just seem daunting. But don't worry, because there are a number of solutions out there to help address those challenges. I like to say that effective technology is the key to balancing the scope with those available resources that you have in your organization. But you can't create meaningful technology without understanding the issues faced in healthcare, privacy, and information security. There's issues faced by a number of organizations, and there's just so many variables that you need an ally. You need someone who has experienced those challenges and who's made meaningful strides in addressing them. And that's where IATRIC Systems has positioned ourselves. We've worked hard in searching for meaningful patient privacy solutions to address these challenges. And our team is made up of healthcare and privacy professionals who understand those challenges and work diligently to craft software solutions that help bridge that gap between the regulatory requirements and the resources that your organization needs to address them. One of those solutions is called Partner Risk Manager. As Iliana noted, there's a number of incidents involving business associates and third parties, and this highlights the importance not only of having a business associate agreement in place, but knowing what's at stake when entering into a relationship with a vendor or third party. Effective risk management is paramount, not only to covered entities, but to any of those associates who are going to interact with protected health information. So this solution is going to help you protect patient privacy and meet those OCR Phase 2 objectives in a number of ways. We're going to provide you with an efficient automated process for vendor risk assessment. We're also going to give you the ability to store and maintain all of that vendor agreement and risk documentation. You'll be maintaining a thorough accounting of your risk assessment efforts, as well as mitigation efforts and what you're doing to address those risks. And of course, you can provide for customized reports and deliverables. Learn from the risks that you have to implement other solutions that help to mitigate those factors on a broader scale within your organization. So this is just one of a number of solutions out there, but we would encourage you to check it out if you want to know more about managing those vendors and third parties. IATRIC Systems is also a leader in patient privacy monitoring. 27% of the breaches assessed were the result of unauthorized access or disclosure of protected health information. Users are going into the records of patients that they don't necessarily need to. This underscores the importance of an effective patient privacy monitoring program. And that's exactly what Security Audit Manager can do. It's going to help to receive and consolidate audit log data from multiple sources in your organization, so you can centralize your auditing from a single interface. Then you can conduct quick, thorough privacy investigations if there was a privacy complaint or if there's suspicion on a particular user or device. You can investigate those items quickly and thoroughly. You can also proactively monitor for privacy violations, and what that means is you're going to be able to identify suspicious activity as it occurs in your organization. Our tool also helps you to leverage some analytics that will help rank and prioritize those findings. If there's a large volume of findings, you'll have the ability to sort them so that you're addressing the most meaningful items first. And it does come coupled with a documentation tool that will allow you to document and report those incidents and breaches as they're identified. For those reasons and more, Security Audit Manager has been recognized by KLAS as the leader in patient privacy monitoring for the last 3 years, and knock on wood, but I'm confident we're about to seal up 2017 and be our 4th consecutive year as a leader in this category. So I do encourage you to learn more about IATRIX systems. You can, of course, look us up online. You could follow us on a number of venues, or you can feel free to give us a call or send us an email to learn more. Now I'm going to go ahead and turn it back over so that we can answer any questions. This also includes questions for Iliana or any members of the team based on today's presentation.
All right, great. Our first question for the day is, Iliana, what is the difference between an OCR HIPAA audit and an OCR investigation following a reported breach?
Great, thanks. So as I mentioned during my presentation, the difference is really the purpose of the inquiry and the instigating event. So any particular investigation that OCR does will be generated by one of those circumstances that I mentioned earlier, and that is either a complaint is filed with us, or we start a compliance review, which is a type of investigation that started as a result of a breach report, a news report, or a referral from another agency. And so we have broad authority to begin what we call compliance reviews, and that is basically just any review of the compliance activities of an entity, based on any type of instigating event or potential report. So those are really how we generally start our investigations. But our audit program is really more focused on determining compliance in the industry more generally. And as for now, is it really meant to result in corrective action or technical assistance or settlement agreements or civil money penalties? It's really just for purposes of trying to figure out how our industry is doing from a compliance perspective and what tools and guidance we need to provide or what best practices we can share. Now, that's our current approach to our audit program. That's how we have approached the last 2 phases that we've undertaken after the passage of the HITECH Act, which included the audit requirement. How we move forward in the future, I think, is still a question that is open for our office and is something that we're looking at as we move forward with the audit program.
All right, great. Our next question says, our EMR vendor is one of our BAAs. They are developing a capability to identify newly registered patients for possible consideration for any clinical trials we have at the time and are accruing for. What additional issues or steps must we have in place beyond our standard HIPAA privacy notices?
So I think that's a really complicated question. I can't provide a legal or advisory opinion. I do just want to mention that we have quite a bit of guidance on our website about research and research protocols and what that might look like. Certainly, if you're engaging a business associate for any purpose, whether or not it's for purposes of helping you do research as a covered entity, or it's doing your back office billing functions, or it's providing you with cloud services, storage services for your electronic data, whatever that issue is, you do need to ensure that you have a really good business associate agreement in place with that business associate, that you understand how that business associate is going to protect your data, because at the end of the day, it is your data. So not only is it patient data that has really important privacy concerns, but it's also all of your intellectual property. So from a contracts perspective, that's basically what your company is worth at this point in the world that we live in. So you really need to ensure that you understand how that entity is going to protect the data that you hand over or that it creates for you, how it's going to notify you in the case of not only a breach but also a security incident. If there have a security incident that doesn't necessarily rise to the level of the breach, how are you going to deal with that? And if there is in fact a breach, who's going to do the notifications and when? The rule does not necessarily require that any one particular entity does it. Ultimately, the covered entity is liable for making those notifications, but if the covered entity wants the business associate to do that, that's something that you should work out before a breach occurs, because once that 60-day clock starts ticking, any business associate breach is attributed to the covered entity during that 60-day period. So if your business associate doesn't notify you until day 59, it's going to make it very difficult for you to deal with any particular breach notification situation in a timely manner, whether or not that's notification to OCR, notification to the individuals that were affected, or notification to the media, which is all required in cases where 500 or more individuals are affected. So as I said, it's really important that in any business associate relationship, you understand, given the purpose for the relationship, so if it's research, if it's cloud computing, if it's billing, if it's document storage, if it's document destruction, whatever the relationship is with your vendor, understand what the safeguards are that need to be in place on that data. So the data that the business associate is holding for you, that they're creating for you, that they're transmitting for you, what types of safeguards need to be in place to keep that information secure, and what kind of responsibilities is that business associate going to have to you, the covered entity, because it's your data? How are they going to flow those safeguards downstream as well? So think about the life cycle of the data just as you do with your risk analysis in any business associate relationship, and ensure that you understand, okay, what are we handing over? What are the risks to this data? How do we expect our business associate to protect it? What's going to happen when there's a breach? And at the end of the relationship, how are we going to get our data back? Or how are we going to ask that business associate to destroy that data? Because it is not the business associate's data, it's the covered entity's data. So these are all issues that you should look at in any business associate relationship. We have, again, a bunch of guidance on our website about business associate relationships, including sample business associate provisions. And as I said, our cloud guidance walks through a lot of these types of issues as well. Any particular research questions, I would refer you to the guidance that we developed with the National Institutes of Health on issues specific to research, because that's a whole presentation in and of itself.
All right, great. Our next question, how long are we required to keep our audit logs? Is it 6 years like other HIPAA documentation, or 1 to 2 years?
That's a really great question. And audit logs are, we understand that audit logs can take up a lot of space, a lot of storage space from an electronic perspective. So the HIPAA security rule in not just with regard to audit, but with regard to all of the implementation specifications, is meant to be flexible, scalable, and technology neutral. So the point of that is that we have not issued specific guidance on how long audit logs need to be maintained. But what we have said is that
entities need to have them, they need to review them on a regular basis, and they need to ensure that they respond to any incidents that may be uncovered by those audit logs. So, how long you keep them is going to depend on how you as the entity is determined the best way for you to implement the controls around those audit logs. So, how long do you need to review them? How long is it going to take you to investigate any particular situation? How long, do you need to make sure that you have them for documentation purposes? Do you need only certain audit logs and not others? That's really a decision that the entity has to make because, again, it's about how you implement the other controls associated with audit logs, because having the audit logs is great, but if nobody ever looks at them, then there's no point in having them, and that's a separate requirement under the rule. So again, it's really about ensuring that you have them, that you use them, and that you appropriately respond to any incidents that they may uncover, and that that will dictate how long you keep them or how long you keep parts of them, etc.
All right, great. That concludes today's healthitsecurity.com presentation. Special thanks to our speaker, our audience, and our sponsor, IATRIX Systems. Thank you and goodbye.